All right, I think we'll go ahead and get started and people can come on in as they join. So Jamie, do you want to go ahead and share your slides?
Sure.
So as Jamie just mentioned in the chat, we are in a caption-enabled Zoom, so please feel free to turn those on. And if you have any problems accessing them, you can send us a message in the chat. So Jamie is presenting today, and she'll give a little overview of what she's talking about and who we all are and why we're here a little bit. But for some housekeeping notes before we start, Jamie will be taking questions at the end. But please feel free to add messages and questions in the chat, and we will get to those. A few of us will be looking at the chat as well as she goes. And if you have any questions, just let us know, or if anything isn't working. So without further ado, I will pass it over to Jamie.
Thank you. Just to confirm, can everyone see just a slide on the screen?
Yep, it looks perfect.
Perfect. Okay, thank you so much for joining. We're going to be talking about spatial data in secondary healthcare research. I'm Jamie Reese. I'm a research analyst with the AJ Drexel Autism Institute on the Policy and Analytics Center team. I want to also acknowledge a contributor, Steve Melly of the Urban Health Collaborative. He wasn't able to be here today, but he contributed a lot of really good information. So I'd like to say thank you to him. This webinar is presented by the PHASES Data Core. PHASES stands for Public Health and Autism Science, Advancing Equitable Strategies Across the Life Force, which is part of an Autism Centers of Excellence Award from the National Institutes of Health, NIH. The PHASES Data Core is like a unit within that project. It's a collaboration between the Policy and Analytics Center at the AJ Drexel Autism Institute and also the Biostatistics Scientific Collaboration Center at the Dornsafe School of Public Health. It's co-led by Doctors Renee Moore and Lindsay Shea. Okay, let's talk about what we're doing today. Our aim is to explore some opportunities for you to integrate measures of interest into your work using spatial data. If you are in a less technical role, the intent is for you to just be aware of the possibilities to link to new data sets. It has technical information, but please don't feel like you need to retain everything. It's really just meant for you to have some insight into what makes it possible to take advantage of those opportunities. And then it'll also give you some insight into what it takes for the people on the technical side to make that happen. If you are in a more technical role, the intent is for you to understand some of the mechanics behind it so that if you want to continue to learn and practice using spatial data, you have a solid foundation to start with. This is being recorded, so you can always go back to anything if you'd like. And like Jess said, we'll have times for questions. I'll be pausing here and there. We have people with an eye on the chat, so please feel free to submit those as you'd like. Okay, so what is spatial data? Spatial data is anything that can be mapped using ArcGIS or similar tools. There are lots of different platforms that are either fully dedicated to spatial analysis or that have some degree of mapping capability. I'm going to focus on ArcGIS because it's a long-standing industry standard. It's very widely used. It aligns with other, with courses that you can take at Drexel, and I use it myself. Two important pieces of information that you're going to find in any spatial data set is going to be spatial information to help the software draw the map, and then attributes, which are variables associated with what is drawn on the map. Spatial information is always going to include latitude and longitude, which tells the software where to draw an element on the map, and then projection information, which the software references to convert the 3D Earth onto a 2D map. The attributes are in a table form. That's where you're going to find your variables of interest. What can we put on a map? We call these features. So they can be points, polygons, and lines. Points are single locations. So for example, addresses there are people in the PHASES data core who use electronic health records. Polygons are going to look like a shape on the map. So there'll be things like municipal boundaries or census tracts. Lines are used to depict linear features like streets. We're not going to talk about them much today just because they're way less likely to be used in this context. All right, so how can all this help you look at new variables of interest? When we're looking at secondary data, a lot of us are used to looking for sources with a common key across data sets that'll let you join it to your own data. So for example, if your data set includes a variable for state and then you find something from a secondary source that also includes state, you can use those to append the variables from the second data set to the first. That is called a table join. But there's lots of instances where you don't have a common key. And if you don't have a common key, but you do have spatial information, then you can use a spatial join to bring those two data sets together. You can think of this as adding layers to a map and then asking the software to add variables from one layer to another based on the two layers' relative spatial locations. I use spatial joins to export files, or like I'll join the data and then I'll export it in something like a CSV so that my colleagues and I can then use it in a statistical software. You can do a lot of analysis in ArcGIS with some more learning and training. We'll share some resources for you if you'd like to start learning that. But for today, we're gonna focus on spatial joins. There are a few different types of spatial joins. One is joining a points layer to a polygon layer. You can think of this as having a map with boundaries drawn on it that you then add pushpins to, which will then tell you what boundaries those points or addresses fall within. So the visual here shows you the blue pins are randomly generated addresses, and then the gray lines are municipal boundaries, Philadelphia and the surrounding area. We're going to look at an example in a bit with area deprivation index, which is mapped to census block groups. This type of join would allow you to take a data set with addresses in it and then identify the area deprivation index for those addresses to use in your analysis. And we'll talk about how that would happen. Another type of spatial join is joining one polygon layer to another. This would help you determine whether and how different shapes overlap or intersect with each other. In this example, you can see the same municipal boundaries in gray, and then you see the smaller areas, the smaller boundaries in orange. Those are census tracts. I'm going to share an example later of how I've started using this as a way to explore health professional shortage areas as context for Medicare and Medicaid claims data. Before I continue, are there questions that have come up so far or questions that you'd like to ask? All right. So now that we know the basics, how do we know when we have a good opportunity to incorporate some spatial data? First thing we'll do is we'll find out what you can already put on a map. So of course you're going to know if you have something obvious like a city, an address, but sometimes we don't notice all of the opportunities. So it's always a good idea to look through your data documentation. You might find some unexpected options in the form of variables with labels that are not very intuitive. So I have FIPS on here, which is it's an acronym for an identifier. GeoID is sometimes used colloquial interchangeably, but they're identifiers for features that you can then put on a map. What you see on your screen on the right is what I see when I pull in census tracts into ArcGIS. So if you remember how we talked about all those spatial data sets having an attribute table, and you see where I've highlighted that ID, that's what you would use as a table join to add your data to that polygon. So at that point, your data is on a map. I think I just skipped one, sorry. Okay, to assess secondary data. Keep an eye out for these types of files. Shape files are very common. They're usually labeled as .shp, although technically they're a collection of files, but .shp is what you're looking for. Another one is a geodatabase. It's another way for files to be organized. Both of those can be read by ArcGIS and other softwares. If you see KML or KMZ, those are frequently used by Google Maps, or you can find tables that can be joined the same way that we just talked about joining your own data. Um, there's some great resources. I'm going to talk to you a little bit about one called Policy Map, where there's a ton of tables that you can join onto to a spatial data set. Once you find some promising spatial data sets, there's still steps that have to be taken before you can link your data through a spatial join. So these next couple of slides they're like a heads up that you'll need to plan ahead and build in more time than you might think. In the case of addresses, ArcGIS does not understand addresses, it understands latitude and longitude. So you have to go through this process called geocoding. And what that entails is choosing and backing up what's called a geocoding service. It's like a reference system for the software. Usually you're going to have to manually match some addresses from your data set onto their locations because no data is perfect. And all of that means you have to really take your time and be careful with documentation. If you are working with areas, so polygons, there's also some steps that you have to plan for. We already talked about how you can find a field to join your data onto. That requires, even in the most straightforward instances, that requires just checking that they're in the same format and preparing, doing any manipulation that you might need to do to make that happen. Polygons can get more complicated in some scenarios where there's constraints either in your own data or in spatial data or boundaries available to you. One example that I'm working on right now is the most granular level of information in the Medicare and Medicaid claims data that we look at is the zip code level. There are no actual zip code boundaries like you might think. Zip codes are actually assigned by the Postal Service and reassigned on a continual basis. It's a tool used for delivery efficiency. So there's a couple of ways that we can deal with this. The first and most commonly used way is that the census does have a geography called a zip code tabulation area, or ZICTA. That one is helpful when you want to link to demographic data from the census or any other data from the census. In my case with the claims data, it's a little bit of a limitation because we need to represent all the records we can, especially when we're looking at populations or conditions without a ton of claimants, because we have to censor things if there's not enough people living in a specific location. So for every zip code we can, that is very valuable to us. If we use that ZICTA, a fair amount could wind up without a match because not all postal codes are represented as a ZICTA. And also, ZICTAs are only updated every 10 years. So if the Postal Service is adjusting them on a continual basis, you can wind up really, really far out of date and either inaccurate or just missing opportunities. In my case, I'm currently using an external source to approximate those boundaries. The one I use is released by Esri, which is the parent company to ArcGIS. But if you find yourself having trouble with that one, feel free to reach out and we can help you navigate that. All right, so some challenges that you can run into. This first point is similar to what I was just saying. Boundaries change over time, not just for zip codes, but for all boundaries. If your data is a snapshot for a year or a series of years, then you're going to need to make sure you're mapping to the boundaries as they existed at the time that your data was captured. So in my case, I can have, let's say, a set of claims that occurred in 1 year, and then another set of claims that occurred in the following year. It's possible that the zip code, like quote, boundaries, which we already know as an approximation, changed during that time. So it's always ideal that we map to the most up-to-date version that's not updated after the point of our data. That also introduces an issue with release schedules. So sometimes you want to work with designations or geographies that are only updated every few years. Um, so you have to make sure you're looking at the right time frame. You have to account for the fact that sometimes your secondary sources might fall behind in release schedules or something comes up. Um, so you may run into issues with that. Um, you can also run into things that sound very similar but are in fact different. We already talked about the zip codes. Another example would be what the census calls an urban area, which is different from a city boundary. This is one that doesn't feel like a challenge when it first happens, but it can cause you some real headaches down the road. So you always want to look at your documentation and make sure you're comparing apples to apples. Like many other data sources and instances, we always have to balance granularity and precision. So margin of error is always going to be higher at smaller geographic units. So for example, a census tract is going to have a much higher margin of error than like a metropolitan statistical area, which is like a whole group of counties. And then finally, you'll have to account for completeness in your data, especially when we're working with healthcare data because of the sensitivity. For example, you might have two sources that have different suppression requirements, which is when you have to censor areas that I mentioned before where there's not enough people. So it would make it possible to trace back to an individual. If the requirements are different on two different data sets, then you might have more areas that have to be censored than either of the single data sets alone. So that can be a challenge. I can pause here for questions. Are there any that have come up, or would anyone like to ask a question?
There's no questions in the chat so far, but I would like to briefly ask a question. You have been talking about the size of the locality or the spatial unit.
Mm-hmm.
A lot of data that I see has state as the smallest unit.
Mm-hmm.
Is there, have you ever run into that, or do you have any suggestions related to a unit that large?
Let me make sure I'm understanding. So you're looking at two different data sets that you want to relate to each other. One of them, the smallest level of geography that you see is a state. Is that right?
Yeah, yeah.
Okay. Yeah, so the only way that the way that spatial data could help you in that scenario is if for some reason the source is publishing a table that only has the state labeled, but in their spatial data, when you bring it in, it actually has like a real polygon that might overlap different or something more granular within the spatial data. But generally speaking, the smallest geography is going to be the smallest geography. There's not much you can do from there.
Thank you.
Any other questions?
I have a little bit of a leading question, and
Sure.
it's why should I use ArcGIS for or something similar for geocoding rather than using like a Google API or something that like sends requests out to Google Maps to give me to geocode addresses in my data set.
Good question, Dan. And I enjoy this pop quiz. We've talked about this. This has been a learning journey for us. The reason is because when you use something live like a Google API, the reference is going to be change. It's changing all the time, or it's changing at the whims of the company that's publishing it. So if we want to be able to reproduce our research, we need to capture and document a geocoding service at a point in time. um, I'm going to share some information about a user group and some office hours for people that use ArcGIS. Um, that if you find yourself in this situation, Steve Melly, who I mentioned earlier, is really knowledgeable about this and can give you some advice about how to gather that kind of snapshot so that your work is replicable.
Yeah, and I think just to add, like one other thing that I'm just going to say so that folks are careful about it is like when you're working like these like geocoded data are like very sensitive. Um, yeah, Carlin's asking, I think because Carlin and I have actually talked about this before too. Like Google, if you're sending an address to Google, Google knows you're querying that address for some reason. So it's a little bit risky, like in terms of like who you're sharing data with, even though you're not sharing any other information. Um, so I think I've researched ArcGIS and they have like some HIPAA compliance stuff that they go through. So it's okay to use their service, but just querying Google is usually not, doesn't fall within that.
A really good point. Yeah. Okay, other questions?
So following up on that, I don't know if you see the chat, Jamie, but as Dan was mentioning, somebody did pop in about using sensitive data. Our ArcGIS, is ArcGIS still something you can use to maintain privacy?
I'm really glad this question's coming up because it wasn't something that I specifically looked into before this webinar. So I think that it's a matter of looking into your like compliance requirements and probably working with whomever your point of contact is for those compliance requirements. I'm going to look into it myself because I'm curious about that as well. Personally, I haven't used anything, I haven't put anything into ArcGIS that has any kind of sensitivity that couldn't be published, I guess I should say. But of course, you probably will run into that with your research. So it's a very good point. Anything else at the moment?
Jamie, could I interrupt for a quick second on geocoders?
Yes.
So,
Is this Tim? Yeah.
yeah, sorry, I should have said, hey. Something else about geocoders at ArcGIS Pro is that if you have the know-how or the documentation, you could also create your own geocoder that isn't necessarily shared out or publicly accessible. So you're keeping that in-house but replicable for others in your field of study. And you could also change the parameters to give maybe your addresses some sort of offset. So you're getting them in a nearby enough location that it's useful data, but it's still general enough that you're not saying like it is this apartment in this building at this point in time, if that makes sense.
Yeah, it's a very good point.
Cool. Thanks.
Thank you. Anybody else? Okay. Okay, so let's go into some examples. First, we're going to walk through how you would go about using a spatial join to match addresses to area deprivation index, which we talked about a little bit earlier. Area deprivation index, if you haven't heard of it, or ADI, this is a measure of socioeconomic disadvantage. It's published by the Center for Health Disparities Research at the University of Wisconsin School of Medicine and Public Health. The website that they publish it to is called Neighborhood Atlas, and there's a link on your screen. We being the PAC data team and others, have started exploring ADI as a variable of interest as we look into social determinants of health. The analysis done by the publishers is done at the census block group level, which is a very small unit that's chosen for its degree of granularity because they want to focus on neighborhoods. The data includes a rank that they rank nationally among all block groups, and they also rank at the state level. All right, so let's say we want to match up that ADI to the ADI of the block group that each address falls within. The first step is we're going to assess what's available to us. So we know in this example that we can download a table with area deprivation index by block group. We know that we can download shape files from the census, including block group shape files. And then for this example, I'm going to talk about electronic health records data again, because like I said, there's people on this team who use those types of data sets. So here's what we would do. The first two steps can happen in any order or concurrently. We'll geocode the addresses in that electronic health record file to create points. The ones you see on the screen are randomly generated. We will do a table join to append the area deprivation index table to the census shape file using that GeoID field. That's going to add the ADI information to the shapefiles attribute table. Once those points and polygon layers are loaded into ArcGIS, you can visualize the data. So it's not joined yet, but it's on your map for you to look at. I give an example here. It shows the stars again are randomly generated addresses, and then the shading is actual data. That's area deprivation index by block group. I have shaded it by actually quantile, so ranges of values that you can make your own choices there. But to get into the spatial join, you can undertake that, and that'll identify which block group each of those stars is within. And because we did that join, we're going to also know by virtue of the block group what the ADI value is. And then from there, like I said, I usually will take the attribute table and I'll export it, and then we can use it in whatever software we would like. And then we can do some further analysis based on what we find there. Before I flip to the next one by accident, but before we do that, I wanted to give an opportunity for questions on this example. All right. This next one I'm going to use to show what happens when we get into some of those challenges, or when we take things as far as we can with a spatial join, what we might be able to do from there. Health professional shortage areas are a measure of insufficient providers designated by the Health Resources and Services Administration. It's used for a lot of programs and like allocation decisions, but we also can use it to get some context about where people are living. So let's say we want to answer the question, I'm looking at my Medicare, Medicaid claims data, and we want to know how many of those claimants live in HPSAs. We're going to again start by looking at what is available to us. We know that there are HPSA shape files at HRSA.gov. There's a nice data. I actually encourage you to go there just to see some of the different file formats that we talked about, because they publish things that are just tables, they publish KML, they publish shape files, so you can just take a look at what that might look like. So we know we have that. We know we have our claims data by zip code. We know that we have an approximation of zip code boundaries. And in this example, we also know that there is a crosswalk published by CMS, which is the agency responsible for Medicare and Medicaid, that has like a flag variable for whether a zip code is in a health professional shortage area. Now, that option is, of course, going to be the easiest option. It's a fine option. It is a readily available source. It's reliable. But the trade-off is it requires us to accept some assumptions and criteria from CMS. When we looked into their documentation, we found that that crosswalk, first of all, is used to determine eligibility for a physician bonus program. So we know that any decisions made there are toward the end of being usable for that program. And we know that a zip code in that data is going to be flagged based on the county that it falls within or mostly within. This means that we need to accept either how they did the spatial join or how they did a series of table joins from zip code to county and with some indicator of whether the county is within a health professional shortage area. If they did a spatial join, there's actually a lot of different ways that you can go about joining the data. For example, you can ask it to tell you whether the center of a shape falls within another shape, or you can say flag it if only if the entire shape falls within another shape. So there's just a lot of things that can go into it. We know from all of that documentation that now counties are playing a key role, but when we bring in the HPSA layer and we compare it to a county layer, the boundaries don't line up one-to-one. So we kind of know at one point along the line, there were some decisions about those designations as well. There are plenty of instances where that's okay. We can accept all of those decisions. But we might run into some issues later with being able to, even in that case, repeat our analysis, because what if the program is discontinued and the crosswalk isn't updated? Or how do we know they're going to use the same methods every time? It requires a lot of, investigating and staying up to date on their documentation. So with all that in mind, we just wanted to check it out ourselves a little bit. We wanted to dig in, put it on a map, see what we were seeing in terms of overlap. So that's where we tried the spatial join. So here's what we did. We followed those preparation steps we talked about earlier for polygons to map those two polygon layers, the zip code approximation and the health professional shortage areas. And that's where we saw what you see on the screen. There's some nuance here in terms of whether a zip code is or is not, when we have just a simple yes or no in a health professional shortage area. This is an area of Virginia, and it shows in the pink with thick white, excuse me, pink with thick white outlines are primary care health professional shortage areas. And then the zip codes are the narrower dark gray outline. And what you see in the area that has no pink but is shaded in light gray, those are zip codes that are not in health professional shortage area, or parts of zip codes that are not in health professional shortage areas. So you can see that while some of them are pretty easy to flag, or even like majority HPSA, there's plenty of examples where there's like a tiny bit of overlap or it's about half. So there's some opportunity to get a little bit of a more nuanced understanding of that. Sorry, I keep flipping by accident. So once we got that on the map, we compared it to the CMS crosswalk, even just saying like, okay, give me if it's majority HPSA. We found that some of the zip codes that have partial overlap aren't flagged as HPSAs at all in that crosswalk. So we wanted to, between wanting to look at it with a little more nuance and then also wanting to make sure that we were capturing everything that we could, we took it a step further. So beyond the spatial join, there are some other relatively simple tools that we can use. In this case, I used a tool called Tabulate Intersect, which calculates for us the percent of the area of a given zip code that falls within a health professional shortage area. This gives us more nuance. It's been used in other studies in the literature. It likely gives us a more accurate estimate of the number of claimants living within a HPSA. However, that's still not enough for us. We're still working on it because it also assumes equal population density across zip codes, which of course we know is not true. I've been digging in. I found a paper published by HUD, who also publishes a crosswalk on zip codes, and it involves looking at population density. They're looking at census data at a very granular level, and then in comparing it that way and sort of backing into some density stuff. So still working on this one, but this is telling you sort of how we start with the spatial join, we see what we can learn, we see what questions we have from there, and then we can explore. Questions about this example? Okay. From here, there are a couple of opportunities for you to build your skills or to learn a little bit more. One of them, this is really good timing. The Urban Health Collaborative is having their 2025 Summer Institute. There are a number of courses that you could take as part of the Summer Institute, but one of them happens to be an introduction to GIS. That's going to be held from June 23rd to the 27th. You don't have to have any experience with ArcGIS. There's some information here about the instructors. You can learn more about them and more about the course itself. at the link shown on your screen, and you can also see what other courses are being offered for the Summer Institute. Another opportunity is to come to our next webinar. So we're going to take the baseline information that you've learned here. We're going to have a little bit of a more interactive session so that you can start to identify opportunities in your own research. We're going to hold this in late summer or fall. And this is another example where you don't need any technical experience. There are some resources that are available to you now and on an ongoing basis. One of them is access to ArcGIS. So when you're with Drexel, you can just reach out to the help desk. They'll set you up with an Esri license. That will give you ArcGIS Pro, which is the desktop version. It's very powerful. It has a lot of really great analytic tools. It'll also give you access to ArcGIS Online, which has some really neat, I think it's a little more accessible. It also has some really cool visualization options and better ways to share maps and things that you're working on with others. And then you'll also get access to some data that you wouldn't otherwise be able to get access to, like this tool, Community Analyst Online. I have another link up here that has information on this ArcGIS license, but it also has information on a number of data sources, places that you can go and download secondary data. There's also information about a user group and office hours. And this is, again, that same person that keeps going up, Steve Melly. Thank you very much. It has his information on that page and information about some of the things that he's doing that can support you. More on Urban Health Collaborative. They have this great data repository that is focused on the Philadelphia metro area. So they have health determinants and health outcomes. They have things like population characteristics. When I say area level exposures, we're talking about social, economic, food, natural, built environments, demographics, residential mobility, and then like your typical classic environmental exposures. When we talk about health outcome data, we're talking about like not only health status, but also health related behaviors, healthcare experience and access, birth and death records, inpatient and outpatient, or ambulatory discharge data. So if you're working in the Philadelphia metro area or you're examining it in your research, definitely go and take a look at that data repository. I saved the best for last. This is my favorite resource for tracking down and downloading secondary data. It's called Policy Map. There are some aspects of Policy Map that are accessible for free and to the public. So if you went to their website, which I think is just policymap.com, you would see something similar to the screenshot here, but you wouldn't have access to everything. So I strongly encourage you go through the library. If you log in and go to A to Z databases, you can find it there, or there's like a more direct link here. But that's where you're going to get a whole ton. They say over 170 data sources with location information. You can actually put things on a map and start to play around with visualizing. And then you can also export most things in the form of a CSV, and then you can bring that into ArcGIS if you want. You can do lots of other interesting things with that data. Any questions now? Okay, so one more acknowledgement. This work is funded by the Phases project that we talked about when we started. It's funded by the NIH, and this slide just has some acknowledgement and disclosure for you. We do have a good chunk of time for questions, so or even discussion. I think that the geocoding discussion and the confidentiality and compliance discussion were good. So I'm happy to get into any of that. And also you see on your screen a QR code for a feedback survey that will help us always learn and improve and offer you the best webinars that we can. That'll also be sent to you by email.
Hi, Jamie. I have a quick question. Like for our CMS data or whatever data, if our smallest geo geo unit is zip code, then the ArcGIS or geocoding is not, based on my experience, it's not that useful, right? Because previously we did the ADI and the HPSA scores. Both of them, they already have the crosswalk of zip code to whatever score. And what we did was simply do a join, and then we have the ADI or the score, the HPSA score as the outcome or independent variable. We just directly put them in the regression and never use the
Yeah.
the
Yeah.
spatial analysis. Yeah.
Yeah, I think that's certainly true for ADI, especially because the unit of analysis for ADI is smaller than zip code. So there's very little that you can gain by layering those. I think for for ADI, the spatial join is more valuable when you are looking at something more granular like address. HPSA is that example where yes, the crosswalk is available, but what can we figure out about how we arrived at that crosswalk and what is it telling us? So there's plenty of times when that's like a great, acceptable thing to do, or it's enough for us for our research. But in the example that I gave, the reason that we're looking into it a little bit more is just because it doesn't account for, or at least I think doesn't account quite as sufficiently as we would like for partial overlap.
Yeah. Thank you.
Yeah, good examples.
Hi, Jamie, thanks. This presentation was great. I was today, for example, I was trying to pull up what zip codes belong to Philadelphia County. When I Googled that, you get 400 different results on on that first page. I know for that example, there's probably a resource you go straight to, but in general, are there things you look for that give you an indicator this source might be more reliable, or you might trust them more, or do you really just stick to like certain sites, or yeah, how do you go about
Yeah.
that?
Yeah, I mean, zip code is like the worst one, as as you know, and we've talked about, because it's like it just doesn't exist. So, so I think when I'm looking at something like zip code, where you know that you're making like some pretty significant concessions about accuracy, it's similar to when you're choosing your statistical methods, like what is being used in the field, what is generally considered to be acceptable in the field. Um, I I personally with zip code will use Esri, and which draws from a company called TomTom. And then I think you can trace back even TomTom to one of those resources that you'll see when you Google for zip codes. But yeah, I think it's unfortunately the answer is kind of similar to everything else that we do. We get as much information as we can, and we try to validate from there.
I think US Census has a huge database of all of this stuff, but it's really hard to navigate. So you often have to navigate it like through, like Jonas, you're an R user, so there's like, I think there's a package called like Zipcoder or something that can really help you like pull sets of zip codes from US Census stuff, which I consider the US Census to be usually a pretty good source for things.
All right, we have 15 minutes left. Jess, it looked like you were about to say something.
Yeah, well, I do have another question. I am somebody who I don't have much exposure to spatial analysis, and when I do it, it's often used as, I don't know, like a control variable that maybe approximates a person's condition. So a lot of the analysis I do sort of remains at the individual level, but you sort of control for these maybe the ADI like this example Shaw gave, or some other
Mhm.
more spatial or local area level indicator of, environment or social determinants of health.
Yeah.
I guess is maybe a first step to just start thinking about it more spatially. Like, should I be mapping some of these experiences by the outcome I'm looking at? Or like, it seems like these are two separate fields sometimes, and joining the people who want to show this spatial data and these beautiful maps and are looking at things like this to the people who maybe are doing a more individual level
Yeah.
look at health outcomes or, the correlates of, I don't know, diabetes or whatever. I'm not sure if this question makes sense, but do you have any tips for
No.
trying to combine these two things?
Yeah, I think it makes sense. I mean, if I'm understanding your question correctly, like this is when you're in a place where some like exploratory analysis would be helpful, or some exploratory visualization that you would normally do if it's like statistical analysis. And in that case, depending on what skills you have available to you by virtue of who's working on the project, there's lots of cool things that you can do in ArcGIS or ArcGIS Online. There are also, though, like Policy Map is a really helpful tool. I feel like we should do at least an internal like Policy Map primer, because you can start to explore and visualize patterns without having to put significant work into it, and sort of customize and interact with that and change your parameters in real time. And then share that with other people. Like you can like layer different things and filter them out based on different criteria. We've done that for benchmarking before. And it tends to be, I find it to be kind of quick and easy, intuitive, and helps facilitate conversations that will then lead to like a more robust spatial analysis. Is that, I
No, that
understand your
makes a
question,
lot.
right? Okay.
Yeah, that makes a lot of sense. Thank you.
Good. All right. Other questions or concerns? I will say if we're at a point where we want to conclude, if you've gotten, what you'd like to out of this webinar, great. And you can drop off if no one objects, but I'm also happy to just stay on if you have one-on-one questions, consider it like office hours. That's fine with me too. Thank you, everyone.
Thank you, Jamie, and thank you everybody for joining. As Jamie said, feel free to stay on, and if you are dropping off, just thank you for being here, and we hope to see you in September when we do some more hands-on spatial analysis.
All right. We are still recording, so if anyone wants to discuss